Hello, good afternoon.
Good afternoon, Samit.
Yeah, good afternoon. Good afternoon. Good afternoon, viewers. Welcome to IndiaTreatment.com Facebook page. I'm Samit once again inviting you and welcoming you on behalf of Gleneagles Global as well as India Treatment. So, as you are aware that today we will be discussing brain cancer, right? And the reason is we basically know that May month is basically brain cancer awareness month, and it's our always prime duty, as you are aware that we are not only ensure happy medical journey, we also committed to spread awareness amongst you. So that is the reason we are today with two eminent doctors from Chennai, and one is Dr. Nigel Sams. So no need to introduce himself. He is truly an icon in the field of neurosurgery. Dr. Nigel is itself is a big name. He is the clinical lead from Chennai Global Group, and he has more than 16 years of rich experience in his field. He has done more than 5,000 of surgeries in the complicated neurosurgeries, and he has done more than 24 publications he has already published, and he has written many books and many chapters in different books. So it's indeed a pleasure to talk with Dr. Nigel, and it is indeed once again thank you so much, sir, for taking your time and joining us live. Thank you so much.
Thank you, Samit. Thank you for having me, and thank you for arranging this program, which is going to benefit many
Certainly,
patients.
certainly, sir.
Awareness is
Certainly,
a great
sir.
initiative.
My first question to you is that how with what indication actually? See, nobody comes with the brain cancer itself. Usually, it starts with brain tumor, right, sir? So you with the symptoms or indication get patients for this particular.
Yes. So we'll begin. See, brain tumors can occur in children as well as in
Right,
adults.
right.
In adults, the commonest symptom of a brain tumor is headache. Headache
Sir, I
is the
think we have
commonest.
lost your audio.
Is it? Now can you hear me?
Sir, we have lost the audio. I think we have lost the audio. So can you please once again?
Now can you hear? Now?
Hello?
Hello? Hello?
Sir, there is an audio problem, sir.
I know I'm from this side I am not able to. It's unmuted. Now can you hear? Hello? Yes, can you hear me now?
Hello?
Yes, can you hear?
Sir, I think I am having a problem with my audio. So is this possible?
Is there something you need to do from that side?
Now it's okay, sir. So I'm having a problem with my device itself. Now it is okay, absolutely fine. I'm sorry for the inconvenience. I'm
okay.
sorry. Again, that's okay, sir. I was actually not hearing you for the last. Yeah, please.
So coming back to the symptoms of brain tumor in adults, in the elderly, the commonest symptom is headache, and they may have vomiting. So this is the most common symptom. The other symptoms are seizures. They may have fits.
Okay.
They may have some visual problem. They may have some weakness of the hand or the leg.
Okay.
They may have difficulty walking, speech problems.
Okay.
So these are some of the symptoms in adults. In children also, if the children are very small, The
Okay.
parents will say if they have a brain tumor, if they may be having their head circumference increases in size, the head increases. Otherwise, they can also have headaches, vomiting, fits. So these are the commonest symptoms with which patients who have brain tumors present.
Okay. Okay. Sir, what are the percentage that tumors are converted to cancers? So all tumors are not cancerous, right?
No, no, all tumors. So there are basically two types of tumors. One is the cancer tumor and the non-cancer tumor.
Okay.
The non-cancer tumor is called the benign tumor. That is the benign tumor. That the commonest is meningioma. In
Okay.
cancer tumors, again, there are two types of cancer tumors. One cancer tumor starts growing within the brain itself. That is called a glioma. And
Okay.
sometimes you may get a cancer in the brain which is spread from some other part of the body. Sometimes it may spread from the lungs, or it may spread from the breast, or from the thyroid. So these
Okay.
cancers, they may spread to the brain. These are called metastatic cancers. So these are the two commonest types. One coming from the brain itself called the glioma, and the other
Mm-hmm.
one is a cancer which is spreading from other parts of the body to the brain. The most common are the either the glioma or the metastasis. These are the two most common types of brain tumors, cancers.
Okay. So I believe if it is the first of its kind, so there is a role of neurosurgery, and the second part, I probably is already chances of radiation or the management of radiation will be appropriate.
Yes. So if the
Right.
tumor is benign, which is a
Mm-hmm.
non-cancer tumor like a meningioma,
Mm-hmm.
only surgery and removal of the tumor, what we call as craniotomy and excision of the tumor, is suffice in most of the cases. For any type of cancer, after the surgery, we need to have radiation and
Okay.
chemotherapy.
Okay. So it's basically both of you have to work hand in hand,
Hand in
right,
hand, correct,
to treat. So
to treat.
on this note, I'll request Dr. Krishnamurthy to join us. So if you kindly allow a couple of minutes, I'll take her also in this discussion.
Thank you, Samit, for
Ma'am,
giving this opportunity. Hi.
hi, welcome to this India Treatments Facebook page, and thank you so much for once again joining us. Let me introduce ma'am also. She is from Chennai Global itself, and she takes care of radiation oncology. She is extremely talented. She got a lot of many awards for research work. I was just reading out some gold medal for your research work, so that is fantastic. So thank you, ma'am. Ma'am, I was discussing with sir, and I think you were hearing us from the behind, and sir was mentioning that it's when it's management of brain cancer, it's amalgamation of both of your domains needs very important role. So my questions to you: is every patient of brain cancer require radiotherapy? What's your take on this?
Yeah. Thank you, Samit, for giving this opportunity. And thank you so much, Dr. Nigel. Sir has actually explained in detail about the primary brain tumors as well as the secondaries as also. And he has given a very detailed explanation about the benign tumors as well as the malignant tumors. So it is always a multidisciplinary team approach whenever we treat a brain tumor patients. So after the surgery, see, now let me explain what is radiotherapy and this radiation therapy is actually. See, we are using a high energy X-rays, and it is targeted very precisely only to the tumor part or to the post-operative tumor site. We say the surgical bed, and we stop the growth of the particular tumor. Otherwise, we are going to control the rate of the tumor growth. Okay, so the active component is converted into an inactive component. All right. So when a patient undergoes definitive surgery for a primary brain tumors, if it's going to be a complete excision, they may not require radiotherapy. Okay, if the patient is you have a high-grade glioma or any residual which is left out, if it is not operable, just a patient only if they were willing for a steroid biopsy, if the gross tumor is behind, in those cases they may require radiotherapy in adjuvant setting. If the patient is having a secondary brain metastasis, now even for that matter of even the oligo single, if it is can take them the patient for or a steroid boost for radiation. So that is how we manage the radiotherapy. Treatment going we post surge have a very disease free survival as well as a progression free survival, which adds on to their overall survival. And nowadays the toxicities and the side effects which was there once upon a time with the radiation, now it is very very less with the advent of the high precision radiotherapy techniques.
Okay. Sir, what are the probable reason for this brain tumor or other brain cancer?
So, till today, nobody knows why somebody gets a brain tumor.
Okay.
There are some hypotheses that patient may have had some radiation in the past, maybe exposed to some toxins. But now most of it is in favor of some genetic change. There may be some change in the genetic status which causes these brain tumors. Some people who have had some head injury in the past, they may get a meningioma later on in life. But this is all not proven. These are some of the theories for the causing of brain tumors in some patients, the causative factors. But nothing is established as yet.
Okay, so all are hypotheses basically.
Yes.
Okay. Ma'am, my question to you, who are the common age group for this particular problem? Sir has already mentioned these childs are very prone to this particular cancer. But other than child, any age group, typical age group for this particular brain cancer?
Usually this is after the 5th decade. The patients whomsoever we see with
I think so. I think we are facing some issues with ma'am's audio. Sir, am I audible to you?
I can hear you.
Okay, but I can't hear. Can you hear ma'am?
I cannot hear ma'am now.
Okay. Sir, my question, another question to you. How for somebody who developed a brain tumor,
Yes.
see, for the time being, it is a non-cancerous one.
Yes.
So can it be changed to cancerous one later stage?
Yes. So the tumors which are growing in the brain, the gliomas, which I mentioned earlier. So the gliomas are tumors which grow within the brain. In that, there are 4 grades. There is grade 1, 2, 3, and 4. Grade 1, we usually do not like to call it a cancer. We say it's a low-grade glioma. Grade 3 and grade 4 is called a high-grade glioma. So, a patient may start having a low-grade glioma, which we initially treat. And then sometimes these tumors can recur and they can transform into a high-grade cancer.
Okay.
So gliomas over a period of time, from a low-grade glioma, it can progress and transform into a high-grade cancer. That is possible.
Okay. So if today some patient is there with a benign tumor, so he needs to check on a periodic time, right?
Yes, they have to be under constant surveillance. We do MRI scans periodically, once a year, sometimes twice a year, if the lesion is not showing any signs of growing. But they have to be under surveillance and constant follow-up. They cannot not visit their doctor.
Okay. So two of my patient, they're I think probably not listening us on live, but Asad bhai, I'm sure that you will be joining us on later stage, or maybe recorded version will be hearing us. So your answer I already sir has given. So you are having a tumor that is a benign tumor, but you have to keep on going to a doctor on a periodic basis, and you have to
Yes.
check with the doctor whether it is still at that particular stage or it has moved again, right?
Correct. Correct.
Sir, how fast is it generally spreads? Is there any predictable things, or it's absolutely unpredictable? It's everybody
It's
is
very
unique.
unpredictable. See, the good thing about these brain tumors, they do not spread out of the brain. It
Okay,
remains confined to the brain. Unlike other cancers in the body which can spread, the brain tumors remain confined to the brain, except in the rare, very rare circumstances, one particular tumor may spread, but invariably it remains confined to the brain. But within the brain, some of these high grade cancers, they can spread to other parts of the brain. They may grow across from the right side to the left side along the nerve fibers. You know, it may spread from the brain to the spinal cord along the
okay,
fluid, but all
okay,
within the brain and the spine. It does not spread out of the brain.
okay. So we have got a question to answer. The question is: can stress lead to a brain tumor or other followed by brain cancer? Stress.
No, stress does not cause brain tumors.
Okay,
Stress does not cause brain tumors.
okay. And any other, though you have already mentioned in the previous in the beginning itself, there is all hypothesis. There is no
Yes,
predictable things that leads to
yes,
a cancer. But overall, our daily life nowadays, the way we conduct our life, or the overall pattern of healthy habits has been gone to a toss.
yes, yes.
So how do you rate that, or how do you find that this probably may be an instrumental reason for
No,
this?
our lifestyle does not cause brain tumors.
Okay,
Unhealthy
okay,
lifestyle, what we eat, does not cause brain tumors. Stress does not cause brain tumors. It's not related. But people think that lack
so
of
another,
sleep,
yeah.
some people think lack of sleep causes brain tumors, stress, what we eat. No, these are not linked to brain tumors.
Even another thing is, if you use mobile phones on a longer period, longer time near the ears,
No,
that will lead to develop a
no,
brain. No
that
reason,
has not
nothing.
been proven as yet. Some people
Okay,
have spoken about it, but it is not been proven as yet that use of cell phone, excessive use of cell phone causes brain tumors. Not proven as yet.
okay, okay. So for the final word, let me try ma'am once to take her into the. Ma'am, welcome back. So am I audible now?
Yes, yes, I'm having some issues with the connection. That's
But we can
fine.
hear you now. We can hear you now.
Yeah.
But I was actually unable to hear Samit and you, both of you, sir.
So
Oh,
there was a issue of your audio.
I
So
don't.
we had discussed a lot of things. So ma'am, what's your final take? I think we have discussed quite on this particular topic. So your final take on this particular topic, brain tumor. How do you, or other
I
brain
want
cancer?
tell is, see, most of the patients after surgery, they're very much worried about this radiation therapy. Okay,
Right.
so they feel like the radiation is going to damage their brain and it is going to cause many side effects for them. Should we undergo radiation or should we wait and watch? Like that, they have so much of myths. Okay, when a neurosurgeon says, like, please undergo an adjuvant treatment, I request all the patients not to hesitate to undergo any adjuvant treatments, because nowadays with the advent of all the advanced techniques and the very modern chemotherapy targeted agents and all, we are able to increase the overall survival for the patient. Okay, and we are able to give a very good life for these patients. We are able to achieve a very good treatment outcome, excellent result with this multimodality treatments. So please don't hesitate if your physician asks for any adjuvant treatments like radiation therapy and chemotherapy. That is very, very important. And please come out of all the myths about the radiation, whatever you had earlier. Nowadays, it has become a boon as in the form of an adjuvant therapy, definitely for brain tumor patients, as Dr. Nigel was clearly stating, with the benign tumors and the malignant tumors. If the even if a surgeon feels it's an inoperable case, if it's going to be any benign tumors which is symptomatic, we still have the option of stereotactic radiotherapies versus stereotactic radio surgeries for these patients, where we can have a very good treatment outcome and very good treatment, I mean excellent response for these patients. And as Dr. Nigel was clearly stating, if the patient is going to have a benign tumors, don't just give up on the follow up. Please be in a very close observation. That is very, very important. Now, if the patient is having a secondary brain tumors, like which has been originated from tumor from elsewhere from the body, don't give up on your follow up investigations. That is very, very important. Please see your treating physician as recommended and as advised. That is very important.
Okay,
Okay.
ma'am, one specific question on behalf of a patient. See, he has a small benign tumor just behind the hypothalamus. So he has already consulted a neurosurgeon. He said it's just radiotherapy required, right? So he wants best of its kind. So how do you find cyberknife? Can you please describe on cyberknife? What are the pros and cons of cyberknife? How it is best for that particular kind of patients?
Let me give you an overall picture of the external beam radiotherapy. Okay.
Okay.
Now, if the radiation therapy is being treated or passed from outside, this is called as an external beam radiotherapy. Now, we have two options in external beam radiotherapy, which is going to be the fixed LINAC. Okay, that is the basic X-knife LINAC what we use. If the same LINAC is mounted on a robotic arm, it is called as a cyberknife. It is just a machine name. Okay, otherwise it's a robotic treatment. We don't have much difference between a LINAC based SRS as well as the CyberKnife based SRS. Okay, this is going to be a non-robotic one. That is going to be a robotic one. That is the
Okay.
big difference. Okay, and the tumor response rate, the dosimetric rate, as well as the treatment fraction, which means the duration of the treatment time, everything is going to be almost similar in both the type of treatments, robotic as well as non-robotic. Okay, if the patient, if they are comfortable with the cyberknife based therapy, they can very well go ahead with the cyberknife based therapy. That's a robotic one. Okay, if the patient is very much comfortable with the LINAC based, the fixed LINAC based treatment, they can very well come to a fixed LINAC based treatment, and treatment outcome is going to be the same to
Same.
same, same to
Okay.
same.
Okay.
In
Thank you,
precision
ma'am.
wise,
Yeah,
with
please go
robotic
ahead.
arm advantage, that is the only thing. But treatment outcome wise, that too for a benign tumor, we don't find a major difference. It's going to be very minor.
Okay. Okay. Thank you. Thank you, ma'am, and thank you, sir. Sir, any final words before we close it?
Yes, as Dr. Satya said, see, the treatment is multi-modality. It is
True.
not for cancer tumors. It does not stop with surgery. Surgery is only one arm of the treatment. So it is has to be followed up with radiation therapy and chemotherapy. And the last thing is that once all this is over, they require rehabilitation and a lot of family support. That is what I wanted to. Friends, family, they require a lot of support before they go back to their work or before they go back to school. So the treatment in the hospital has to continue by full support from the family and friends and community.
Okay. Thank you, sir. Thank you, ma'am, and thank you once again who will listen to us. And I believe it will reach to few thousand people. So I'm sure that they will be a little bit educated, and that is what our intention is. If it is educate you, at least 10 people, our overall effort will give us some benefit, or rather we'll be happy. So on this particular note, once again, thank you so much for joining us. Have a good day, ma'am. Good day, sir.
Thank you, Samit. Thank you.